Hey everyone, welcome back to another episode of Medicine in Minutes. I'm your host Hita, and with us today we have Dr. Madhur Khullar, who is a 2025 USMLE match resident into categorical general surgery at the Brookdale University. So, how is it going? And thank you for coming, obviously.
Thank you for having me. It's going well. A little nervous about just kind of leaving my parents, and then also nervous about starting residency. But other than that, also excited to, just leave the studying behind. Not the studying, but like just the USMLE prep behind and start working on something.
That makes sense. So, how are you finding Bangalore?
Been to Bangalore a few times, and it's pretty typical. But yeah, I always enjoy Bangalore. I have some family here, and lots of good places to eat at. So,
it's
hoping
true.
to visit some of those places.
Yeah. Alright, so would you like to give us a small introduction about yourself?
Sure. So again, I'm Madhur. I went to medical school in KMC Bangalore. Born and brought up in New Delhi. I think the thing I struggled with most initially at KMC was just learning a different language to communicate with my patients. And I think having gone through that process, I'm really glad I did that because I was able to connect with my patients much better. Other than that, I think early on in perhaps my second year, maybe my third year, I figured out that I wanted to do something surgical. I was in two minds about general surgery and ophthalmology, and I'm really glad that I got to do a few rotations in the US to kind of figure out what I really wanted. During my internship, I started preparing for the USMLE exams, wrote my step 1, I think 6 months into my internship, and then did a few rotations, finished my internship, wrote my step 2, and then applied in 2024.
Okay, alright, so how was your undergrad? To talk about it in brief.
I feel like I got really lucky with my medical school. It was the perfect balance of exposure to academics and also autonomy to do things in the hospital. So for people who don't know, KMC Bangalore has 5 hospitals. 3 of them are government hospitals and then 2 are the private hospitals. We usually rotate at the government hospitals for the most part, and you get to learn a lot because again there's a lot of footfall. It's often understaffed, so you're managing a lot of patients. I also feel like because my batch was the COVID batch, we got a lot of autonomy during internship to manage patients. We had really long shifts in the ICU. We were able to do procedures. I remember during my ICU shifts, I was alone sending out 20 ABGs every night, and I got really proficient at that. I was intubating, sometimes I was running codes. So again, I got lucky with just being able to learn stuff on the job. Other than that, I think our academics were also really good. Private institutions kind of force you to attend classes.
Yeah, it's true.
So I was, I guess, lucky in that I attended the lectures and our professors were fantastic. I think one important point was because I decided to pursue the USMLE journey, my medical school was super supportive. We also have VSLO, which allowed us to apply to several institutions like Mayo, where I also did a rotation. And from everyone from the dean to the faculty, because our institution had a history of students going out to the US to train, they were very supportive of giving extension for electives and stuff like that.
Okay, that's great. So, how did you decide on surgery, like general surgery per se? There's so many like other branches we would think of, like ortho or other things. So, what made you choose general surgery?
So, for ortho, I never found ortho appealing. I think it might have had something to do with the kind of folks, but the professors were still great. The kind of residents that were there, I did not have a great time. It's kind of a cliche, I always wanted to do something with my hands, and that immediate gratification of just helping someone out just doing an appendectomy, they're not in pain anymore, stuff like that. I always found that appealing, and I think a big thing about surgery is you not only do see patients in the OPD, you also get to operate on them, and often you manage them in the ICU. So you see the full arc of their recovery, and you get to be with them throughout their illness, help them out in diverse settings, and get to do a lot with your hands. I found that really appealing, and I wanted to do something surgical. General surgery, because I think it's a good place to start. I was also always interested in ophthalmology because, again, it has all the components that general surgery has. You have medical management, you have surgery, and diverse set of cases. But I think some of my surgical rotations in the US kind of clinched surgery for me, and I decided not to do ophthalmology.
Okay, that makes sense and sounds great. Alright, so just to start off, general surgery, again, very competitive field, and there must have been some sort of inspiring factor, like a source of motivation for you or role model. So did you have anything?
I think because early on I did not know a lot of people, and most people in India would tell me that it's really hard, I wouldn't get it, or they weren't even aware that international graduates are able to get into surgery. So I took that on as a challenge a little bit, and that kept patients. I got to IMGs. Some of them had really inspiring stories. Some of them I know did a home country residency, then they did research for 5 years, and then they matched in the US. And while I didn't want to go through that much, it still felt like I could do it because I saw other people do it. And when I was in the US, no one demotivated me. Everyone was very supportive. I think all my mentors with whom I rotated, while they were aware of how difficult it is, and they made sure that I know that, they never said that you won't be able to do it. They told me that if I put in the time, and it can work out, and it should, because it has for other people. And that's what the other residents that I'm close to also said when they talked about their journey. I saw that the kind of stuff they did, and that really pushed me to pursue surgery.
Okay, so quite the encouraging story. Yeah, so you've done your rotations in different surgical fields, and you've worked a job and currently are working a job. So you've been in the OT quite a bit.
Yeah.
So is the surgical life as hectic and as stressful as people make it seem?
Oh yeah, 100%. You often don't have time for a personal life, and I don't want to say all the cliche things that every surgeon says, but I came to it from point of view of, hey, everyone says this, but I'm different. I can do everything, but I wasn't able to. You don't get time for a personal life. You're in the OT a lot. You're on the floor a lot. You're handling all sorts of emergencies. You're handling non-clinical work. You're often working with the whole team to get insurance approval, reconciling meds, stuff like that. So I think if you want surgery, definitely come prepared that it's going to be rough times and the training is going to be intense. But I think if you like being in the OR, if you like seeing patients in the clinic, if you are happy to do procedures in the ward, it's really rewarding, and that is the thing that still keeps me going right now.
So it's something you should go into purely driven by passion.
Yeah, if you don't like the fact that it takes you away from other things in your life, or if you're not just like, if you don't get that feeling of, oh, I can stay in the OR for 14 hours a day, then I'm not going to say that you don't pursue surgery, because there are many people who still do really well, but I think that's definitely one thing you should consider before investing so much of your energy into trying to get into something that's so competitive in the US, because then once you do go down this path, it's really difficult to backtrack.
Yeah, that's true.
Yeah.
So you've just matched into your surgery rotation, so it's still very early to ask this, but do you have any plans for after your residency?
I want to pursue subspecialty training. There are things I'm interested in, and there are things I know that I definitely do not want to do. I hope the rotations I have during residency change that. I hope they're amazing. See what I like. Likely that I'll be able to figure out by the end of second year what I want to do. And that's what I'm going to pursue research in, and then maybe match for fellowship later.
Yeah, all the best for that. So, looking at surgery in the perspective of an Indian medical graduate, we're always told from everyone around us, just if you're thinking of surgery, just stay in India. And there are very few that go out to do surgery in the US. So
Right.
what made you choose the US pathway?
So this might be a little controversial, but I feel like everyone who's done rotations in the US knows this. That good surgery training, I feel like has two components. One is excellent supervision early on, and then graduated autonomy. As you gain more confidence in being able to do procedures, you're allowed to do a lot more. And I think in India, you often find that you have only one of those during training. So I know that in central institutes, you don't get to cut. You get to see a lot of complex cases, you get to observe a lot of good technique, but you don't get to do a lot of stuff with your hands during your general surgery training. I think in state colleges, you get to cut a lot. You're left alone a lot. But in my mind, the negative aspect of that is not being able to do the things the right way, because I've worked with residents both in India and the US, and I've seen that often in India, when residents were left alone, it was pretty challenging to figure out what the next step was, even in basic procedures. Also, I think the exposure, because of the longer training, is better. I saw that third year residents during my rotations were able to do half of a lap chole, where here, at least in my institution, either wasn't a thing, or they often didn't have they often just held the camera. So I think the US offers those two things, which is excellent supervision, graduated autonomy. I am also really interested in research, and while India has a lot of talent, we don't have the funding often. And again, I just want to clarify, this is not a knock on any Indian surgeons. I think Indian surgeons are great because they get to see a lot of patients, and they're as good, if not better, than surgeons in the US or the UK, because post their training they do a lot of cases. We have a lot of footfall, but again, that's not something you get to see during your training. It's always post your training. So that's why I decided that I want to train in the US.
It's quite the interesting perspective, and actually makes a lot of sense coming from someone who's done it. Then, yeah. So now coming into your USMLE pathway, we know we have the steps, obviously. So how was your timeline, like preparation?
So yeah, again, don't do what I did. Start early on, but I did give my step one during internship. I think a better time to give it is during third year, and obviously do your rotations during internship, because you get, if your college allows you extension, that's the best way to go about it. So yeah, did I think step one 6 months into my internship, took extension for electives, spent about 5 months in the US doing my electives, came back, finished my internship, took a few months, maybe 3 to 4 months to write step 2, and then did not apply during that cycle, ended up applying during, I think did not go about planning it in the most, in the best way, because it certainly could have been that I applied earlier, that I finished all of my steps earlier, but I guess it worked out.
Yeah. So yeah, it worked out pretty well for you. So during your preparation, what would you say are things that worked for you, and what would you say are things that did not work as well?
I think that the the things that worked in my favor were having good rotations, having good scores, having decent letters, having a good personal statement and a well-rounded ERAS CV. I believe that I got lucky because I'm not a conventional general surgery candidate. People who match into general surgery often have years of research under their belt. They pursue at least 1 year of postdoc research, often unpaid. That's something I wasn't prepared to do because I couldn't kind of afford it, and even if I was able to, that's not a position I wanted to put my parents in. But yeah, some of the basics that you really should focus on is, and if you don't have these things, again, it doesn't stop you from matching into general surgery. So I don't want to say that if you don't have good scores, you won't match, but it certainly makes it harder. Try for good scores, try for great rotations, and all this needs to be planned ahead. So make sure you start early on and just keep working on your CV, just keep doing things in that field. Honestly, if I were to give advice to someone coming into general surgery or someone applying to general surgery, I would say do research. Do research in medical school, learn research skills, not go after publications, because you can have 10 case reports and not know how to do an outcomes-based study. And do a postdoc in the US. If you're able to get a paid position, do it for 1 to 2 years. It will be much easier for you when you apply.
So basically just plan your timeline properly.
100%, yeah.
Alright, so now when it comes to your actual surgery, so how different is surgery in theory versus surgery in the OT?
Well, that's a good question. I think, again, it depends a lot on which subspecialty you're in. So I am currently doing a job in plastic surgery. A lot of plastic surgery is being very creative. They do a lot of flaps, they do a lot of aesthetic work, and if you don't have an imagination, do not go into plastics. But if you're doing, let's say, minimally invasive stuff, I'm not going to say that that's less challenging or you need to not be as smart as a plastic surgeon, but a lot of the cases might be more straightforward. What you read in the textbook, the kind of complications that you expect, the kind of training videos and the training material that's out there usually covers broadly everything that you might encounter in the OT. And I think operative procedure is pretty standardized, and every surgeon has their own way of going about certain things, but the main chunk of the surgery is same throughout what's written in the textbook or in papers.
Okay. So do you think your job in plastics would influence your decision for your super specialty in any way?
I definitely wasn't interested in plastics before, but I really love plastics now. I will seriously consider doing a fellowship in plastics if nothing else comes to mind at the time. But because plastics has a lot of diverse cases. You can do reconstructive work, there's aesthetic work, and a lot of it, you do really change people's quality of life. Aesthetic surgery is just very superficial, and it's not, like, they look down on it, but I do think it has a lot of value, and we'll see what goes.
Alright, so now for your rotations. So because you got some pretty great rotations, how did you get these rotations? How was your approach to getting these?
Yeah, so I was, again, COVID batch. During COVID, they had shut down almost all of the rotations. I think I sent out around 600 emails. So my recommendation would be persistent. And if you find an email of a program coordinator, of a GME coordinator, email them and ask them if they have an opening. That's how I got my first 2 rotations. And then once, so I did 4 rotations, 2 at University of Illinois at Chicago, and 1 at Cleveland Clinic and 1 at Mayo Clinic. I got the UIC rotations through emailing. They said that yes, you can apply online. I did. And then when I was there, I said, hey, I want to do a rotation next month, do you have an opening? And they said yes. So if I wouldn't have asked, I wouldn't have. Another interesting thing that happened was I got my Mayo rotation through VSLO before. So I had but it was in April, so I had 3 months in between where I did not have. I reached out to Cleveland Clinic saying, hey, I'm already in the US. If someone cancels, I know you don't have an opening, but if someone cancels, I can be there at really short notice. So just think of me if someone cancels. And they ended up giving me an ophthalmology rotation 3 weeks later. So again, be persistent. All of the rotations are available online. All of the emails are there. Be a little shameless, use your connections, ask people if they can help you out. Be polite, of course, and in the end, be generous to your juniors. If they're asking you for help, give them genuine advice. Don't give them generic bullshit that you're telling everyone.
That sounds good. So, how different is working in the US compared to working in?
So, it's very different, and again, it depends on the kind of practice you're in. Private practice in India, I've experienced that there is a hierarchy system where you have a boss and then a few surgeons underneath him. All the patients get admitted under the boss. All the patients are at least seen by the chief attending once or twice. This might be similar in private practice in the US, I'm not sure, but at least in university practices, I've seen that each consultant, each attending has their own cases, has their own patients, and while they might do clinic together, even their follow-up patients are just, you're not seeing the other attending, you're seeing the same attending. The other differences I noticed were differences in training, which I already talked. Outside of that, I think work-life balance is much better in the US. I know many surgeons who do 2 weeks on, 2 weeks off. So they're just able to chill at home for 2 weeks. Here, if you're in private practice, and most surgeons do go into private practice, you just need to keep coming back to the hospital, otherwise you're not making the money. There's a lot of pressure. So, I mean, that this might be there in the US also, but like you also get a lot of free time and work-life balance once you're an attending, once you've established it. So I think those are some of the major differences.
Okay, so now again, tying back to your rotations and the actual program you got into, what are some points that you would advise for us to consider while picking out these electives or picking out the programs?
The programs that you apply to?
Yeah.
For surgery, apply broadly. Apply to every place that offers you a visa. If you need a visa, email every program director, program coordinator that you're interested in that program. Because as an international grad, you will not get that many interviews. And even if you get a few, you can match. So I'd say for applications, apply broadly. See where other IMGs have matched. This is again pretty generic advice. Even if the program has only one IMG and you know that they've come through some connection, still apply to that program if you can afford to. For rotations, do rotations that allow you some hands-on first. If you're able to do rotations during medical school, there are lots of options to do hands-on stuff. Even if you're going through an agency, you get to do hands-on. Surgical rotations are much easier to get through if you're operating. If you're just standing there for 8 hours in the OT, it's pretty depressing. So do that if that's the only option. If you're able to pursue a research rotation, I know Johns Hopkins has a research rotation. I think that can be helpful in networking. And I think the main purpose of the rotations are a couple. Obviously getting your letter. Think about that in the first week of your rotation, and the next thing is networking. I'm not very good at that, but if I were to advise someone who's my junior who's planning to do general surgery, I'd tell them that speak to everyone, be polite, ask them if you can work on a project during your rotation, ask them what their expectations are during the rotation. You have to be really good, you have to impress them without being obnoxious.
Yeah.
So I think those are broadly very scattered things that you could do. Yeah, I don't have any more pointed advice, but if someone does reach out, I'd be happy to help them.
Yeah. Okay, and now coming to like the interview aspect, you said it's hard to land interviews in the first place.
Yeah.
So with the few interviews that IMGs would get, what are some pointers that you would say? Some points to keep in mind while preparing for the interview.
Sure. So I was lucky enough to be able to reach out to residents in the program. At all the places that I interviewed at, I knew some of the residents. They did give me a few pointers about what the interview looks like and if there's any change up that year. They're not gonna give you specific advice because that's a violation of the interview process. But the most important thing is to be prepared for your interviews. Don't wing your interviews. No matter how good you are, have your answers prepared for all the commonly asked questions. Have scripted answers, and they should sound like you just made it up during the interview. And the thing about that is that it allows you to jump onto other topics if you're not stressed with just thinking about what they've asked you, like the commonly asked questions. So let's say they say, if you've not prepared, tell me more about yourself. You're not able to like think about anything other than what you're thinking at the moment. So if you have something prepared, you're able to jump to different topics. Definitely do a thorough preparation of commonly asked behavioral questions. If you're able to research the program prior by reaching out to residents, do that and see what worked for them. And I think approach it that way.
So it's like a scary process, but with the right amount of background research, everyone should be able to.
Yeah, I think with the right amount of preparation, you can go through it without much anxiety.
Right. Okay. You were talking about the rotations that you've done in the US. So is there any specific points in this that you would want to bring up?
Yeah, I think I really messed up with my letters of recommendation because I did not stay in touch with my preceptors, which led to them kind of ghosting me. It was a real struggle towards the end, just getting all my letters. To be honest, I almost felt like I won't be able to apply this cycle and I'll have to do a research year and get letters that way. But because I had done well, because the residents really liked me, they reached out to the professors for me, and I was eventually able to get, I think, 3 out of 4 of my letters. So one thing I would recommend is tell them early on that you need a letter. Ask them what their expectations are and go beyond what they expect so that they give you a good letter. And at the end of your rotation, ask them to put the letter on file. So either send it to the department coordinator. I think find ways to reach out to them post your rotation. So if you publish something, it might be a little annoying, but reach out to. I know we have that in our heads that I'm annoying this really big person that I worked with. They're a star in their field. This is a case report I published that is not even in an index journal. But reach out to them, find ways to reach out to them. Don't annoy them. Be polite, be brief, but yeah, find ways to stay in touch with them so that they don't ghost you.
That's some good advice. And again, it's such a taxing, such a long journey. How did you, what are some things that you did to help you get through?
That's a really good question. I think it's, for many people, it's going to be a struggle unless everyone around you is super supportive of what you want to do. And while my family was definitely supportive, I did run into a few issues with them on just extending my timeline a little. I think something that really kept me motivated was this is the only thing I saw myself doing. I would take anything surgical. Like if it came to that, I would do anything that involves surgery. I really wanted to do general surgery and I'm lucky that I got it, but I wanted to do surgery. So that always kept me going, that I couldn't see myself doing anything else. If you're one of those people, definitely think about surgery or radiology or whatever you're interested in. Other than that, just seeing some residents I had connected with who were really nice during my rotation. They were lovely people. Seeing that they had matched, they were IMGs. That also, somewhere in my mind, kept me going. Also, there is this, I think, exaggerated confidence maybe, or I don't exactly know what to call it, where I kind of felt like, yeah, I'll be able to do it. So I think that kind of that might be a little stupid, but it really helped me, where I really just felt like, oh, I'm not getting more interviews, and probably didn't do well in this interview, stuff like that. So if you have confidence, if surgery is what you want to do, that's what.
So, lightening things up a little bit, how was your match day? What were you doing? How were the feelings?
Match day was nice. I'm glad I matched. My parents were really excited, and I think just seeing that really made it more special. My friends were really proud of me because, again, I have some American friends who went to American medical school. They understand how challenging it is for international graduates to get into such a competitive field. So that really made me feel good. Other than that, I didn't really go out and celebrate a lot. Kept it chill.
But that's the best way. Okay, so again, surgical fields, we're told that research is very, very crucial.
Mm-hmm.
You also mentioned that. So in your undergrad, what kind of research did you do?
Again, when I say I got lucky because while I did do many projects in my undergrad, I was only able to have one publication. Surgery applicants either have more research experience or have more. Mistake I made in college, don't do that. If you're on a project, see it through, because when your name is there on the publication, it will be worth it, even if it's just for numbers, because those do matter at the end. I think something most Indian medical students might have experienced is that they do a lot of stuff on a particular project, but either they don't get the credit or their name is like last after all the department folks on the paper.
Yeah.
I'd say don't be dejected by that, because that's how it is throughout the country. I know that outside they're very particular about who gets to be first author, senior author, corresponding author, and you will get your chances. So focus on building research skills most importantly, because if you're able to do statistics, if you're able to write a protocol, if you're able to see research questions that are out there, I think that's more valuable than just having 10 publications which are not great quality or like just are only case reports. Of course those are important because you still need the numbers, but focus on building research skills.
Quality over quantity.
Yeah.
Alright. Okay, and during your undergrad, what would you say are some of like the skills that you developed that helped you later in the process?
So I think in internship I did a lot of hands-on in the OT, and I know that during my rotations my preceptor was very impressed by my surgical skills at my level. Other than that, I think they were impressed by the fact that I was willing to stay 15 hours in the hospital, 16 hours in the hospital. When I did one incident during my Mayo rotation where it was 11 p.m. We had just finished the third case of the day, kidney transplant, and they were setting up a perfusion machine for a kidney that had come from outside. So basically you pump cold water through it and it reduces the ischemia time, keeps it fresh for longer, and it was just me and the fellow, and the surgeon was still operating, and we had to set up the machine. But the machine is usually set up by the technician. The technician wasn't there anywhere. For 15 minutes of this, they told me that they'll figure it out and I could go. I said, no, I'll stay. And then I think 5 minutes later it struck me that there must be a video online on how we can set up this machine. I was able to find that video, and then with the fellow we both set up the machine, finished all the paperwork, and once the surgeon came out of the OT, the fellow told him that I had helped out and that I figured this out, and he was really impressed that I was willing to stay and help out. I think those are some of the things that will take you a long way, not only during your rotations, not only in just getting good letters, but also in your career.
Taking every opportunity you get.
Definitely.
Alright, and what about like extracurriculars? How important are they? Like, how do you balance this with college going on and like step preparation?
Yeah, it's challenging, but I'd say find time to do the things you like. So I like to play tennis. While right now I'm not able to find time, when I was preparing for USMLE, I did play a lot. I represented my college in events. Yeah, just find those things that you like doing. Maybe don't pick up a new hobby if it's really hectic. It's certainly going to be challenging to juggle so many things, but I know that you're doing so much stuff, and the person who's recording this video is doing so much stuff. So it can certainly be done, and you guys look like a happy lot. So I think if you enjoy what you're doing, it's pretty doable.
Oh, thank you. But yeah, it's for a lot of medical students. We're told how important it is. So from your perspective, from like the program director's perspective, what emphasis would they put on the extracurriculars?
I think it helps if you're a well-rounded personality. If you have really strong academics and that's the only thing that you have, I think, again, most of us don't know why we got interviews. Some of us know why we matched. So I definitely think that just having some things other than academics really helps. So I know a lot of people who are musicians. That part was brought up during their interview. My tennis was brought up during the. I know that some people did a lot of fantastic volunteer work. I also worked a lot. Again, just don't have only academics. I think it really goes a long way if you have a personality outside of medicine.
Like holistic development, but you also have to steer between
Sure.
it.
They like that. They like seeing that they're talking to a real person. They like seeing that you're not only just this
Scores.
person going like head first into just trying to achieve an outcome, but you're also just you like doing other things and you're a person and they're talking to a person. I think that's important.
So like for the cliche, to focus on the journey more than the destination.
Sure, yeah.
Alright. Okay, so again, during your entire process, what piece of advice would you give? If you had to give one single thing to like a med student that's preparing, what would you say is the best piece of advice?
Okay, so I'd say two things. Be persistent, be consistent, because you're gonna get beat down a lot. You might not get a good score. You might not get good rotations. Some people might say some really offensive stuff to you during the rotation that happened to me. But again, you need to remind yourself why you're doing this and just keep pushing forward. I think having a good set of friends around you who are supportive really helps, who understand that you're dealing with something challenging and are not contributing to all the negativity that you're getting. I don't mean to make this sound like some insane achievement that I've made. I have a lot of privileges. I was able to do rotations. I was able to spend money because my parents could afford sending me to the US. I think acknowledge your privileges, stay humble, but you need to push. Especially if you're trying to go into something unorthodox or really competitive, for example, like orthopedics, I think the average number of abstract that an IMG needs is 100. So that's not easy to do. Yeah, be consistent and just try to push forward without getting sad.
Yeah, that sounds great. So thank you so much for giving us.
Thank you for having me. It was lovely.
Yeah, so thank you for all your insight into this journey. It was truly very informative, like to everyone and me especially.
Thank you.
So thank you guys for tuning in, and we'll see you in the next one.